And welcome back. Just Leadership USA is a not-for-profit and a national not-for-profit that's dedicated to decarcerating the United States by educating, elevating, and empowering the people and communities most impacted by systemic racism to drive, amplify, and to sustain the kinds of policy reform building that thrives for sustainable and healthy communities. And joining us now and sharing a little bit more, we are pleased to be joined by the President and CEO of Just Leadership USA, DeAnna Hoskins. And DeAnna, glad to have you.
Thank you, Daren. Thanks for having us.
Yeah, when we talk about decarcerating, obviously that's a huge issue across America, more particularly New York City. Let me go a little bit closer to the borough of the Bronx. And right there in the Bronx, right in New York City's area, we've got the whole issue of Rikers Island. Just share with us a little bit right now about your work, and then we'll talk a little bit about Rikers Island.
Thank you, Daren. So I took over Just Leadership in 2018. In 2016, the founder launched the Close Rikers campaign. And he launched a campaign based on personal experience of Close Rikers, but also the atrocities that were happening at Rikers, right? They commissioned a report called the Littman Report when Judge Littman pulled a commission together. The federal government had also did a report of just the atrocities that were happening, the violence that was embedded into the culture of the facility and moving forward. So we continued on with that campaign, empowering those who had been impacted by Rikers Island, individuals, their family members who had experienced the various deaths, the various violence, and actually lack of care on Rikers Island. So now we're here in 2021. The vote to close Rikers went through City Council in 2019. We received the vote, the council voted that Rikers should close by 2026. What we're starting to see now, what is happening is, while we don't want to see anyone die, it is the reason, it is further entrenching the reason that this facility must close, that the operations of this facility and just the way the facility was even built is unsafe for individuals to be there. But also the decarceration. At one time, New York City incarcerated over 22,000 people on Rikers Island. Right now, we're holding at about 5,000 or a little more. And once the pandemic hit, we were right up under 4,000. So there is an uptick in the number being incarcerated, but definitely a decarceration strategy. The goal of the barrel-based facilities was three-pronged. One, individuals should be closer to their family members. Trying to get to Rikers Islands to do visits was actually inconvenient to families. It was actually a hassle. Getting individuals to court, what we're starting to see right now with the shortage of staff, people aren't even able to make their court dates in the various barrels because they're housed on Rikers Island because of the transportation. And then three, what is a facility should be doing? Should a facility be addressing the core issues or the root cause that actually generated the actual incarceration? So for us, what we see happening now, the vote's there. We see this mayor kicking it down the road, kicking the can down the road, right? And while we're happy to see a new mayor come in, we already see talks that this mayor possibly is going to try to kick it down. And what has happened, it's become a political issue, right? No one really wants to execute this on their political watch, but the fact of the constituents, the residents of New York deserve better, and the constituents and just the over cost of the facility management that we're actually going through at this time. The cost factor of what it costs to house a person on Rikers Island, one, because of the construction, the lack of security, the accountability. You have so many correctional officers, but again, if you've ever worked at a correctional facility, the lack of updates, the lack of 21st century that this facility holds is just a hazard within itself, not only for the people who are confined there, for the staff as well.
Yeah. And, you know, everybody hears, and we hear of another tragic death, people dying while in custody, and a lot of outrage across New York City. But let's get at it. I mean, really, this is something that should have been handled a long time ago. And we talk about possibly kicking it down, kicking the can down the block a little bit further. But are you optimistic, at least, that with the decarceration efforts that are being put forward, that we can see some substantial change?
I really am optimistic, because what this has went from is a criminal justice concern and issue to a human rights and civil rights, right? The individuals that are incarcerated there have a right. They were not sentenced to death. They were not arrested to go to death, right? And you had a responsibility once they're in your custody and care to man for them. Now, let's be honest. There's been 14 deaths in New York. I think one was at NDOC, but this isn't breaking news. This is the reason the continuation of why the campaign launched, right? So there were a couple of things. When I look at the news, when I read the reports of the individuals who have died, some of them certainly have died from the acknowledgement that they had COVID. So that's the lack of emergency preparedness and prioritization of the individuals in a vulnerable situation around even access to vaccines, or were they there on a charge that they could have been released back to the community awaiting charge. But then there's another factor that I don't think we're talking about, that a number of these individual deaths have been suicides. Mm-hmm. And some of those suicides have been related to individuals who had mental illness, right? So what we know, again, my argument is the lack of automation, the lack of updates that this facility has. There's no connection between the community mental health system and Department of Corrections. So when you get to the Department of Corrections, mental health is self-reported. Most people, especially from Black and Brown community, there's a stigma associated with it. And especially in correctional facilities, because in some facilities, you have a different color uniform that everybody knows you have a mental health diagnosis, or you're put in a special population. So if I get arrested on Rikers and I don't identify my mental health, I'm now arrested, no longer have access to my psychotropic medication. I have given no signs of suicide ideations, and then I'm put in a cell and I commit suicide. That's not something the facility could have acknowledged, right? But if we had systems that actually worked with each other and systems of accountability, and also I question this, every jail has an intake where you sit down with an individual, and sometimes in that one-on-one conversation, some diagnosis or visual diagnosis can occur, right? Does that even happen at Rikers Island with the shortage of staff? Everyone who is taken into that facility should go through a visual assessment of their mental health, their physical health, to even be part of a general population before they're put into those population pods.
Yeah, and I want to take a moment to talk about something that you raised earlier about lack of emergency preparedness. We would think that when you're in the criminal justice system, when you're looking at these jails, that the one thing that should be standard is that you have this emergency preparedness system. But what COVID has shown us, what storms have shown us, is New York City, as a whole, is not prepared for emergency preparedness. But when we talk about the jails, even worse.
Yeah. So that was what we discovered at the height of COVID. Everyone was calling for the release of individuals, and we knew that jails and correctional facilities were not able to release. I always call Department of Corrections the babysitter, right? The judge, parent drops the person off, tells you when the person can be picked up or released, and you can't let that child go until that date or that parent returns and tell you to release that child. They have no authoritative, but the mayor does, the governor does, to actually overrule that parent's drop-off rule. But what we discovered was that correctional facilities and jails were the only congregate living in this country that was not mandated to have emergency preparedness. And as you said, COVID made it national to everyone, but storms have shown us that there was no plan to preserve the lives of the individuals who are actually in the custody and care of the facility. There, however, is a plan if the facility feels threatened or taken hostage by the individuals. There's a plan of action of how you respond, but there was no plan. So Just Leadership launched the Just Us campaign. And that is to push legislators to adopt emergency management style plans that preserves the lives. You can't create a plan in the middle of an emergency, but what time is showing us, especially with climate change, that emergencies are going to continue to happen, storms are going to continue to happen, and how do we preserve those lives? I think another one to bring is that part of our plan asks for access to whatever the intervention is, such as the vaccine. And what we saw from the mayor's release of the vaccine access, again, Rikers Island individuals were put to the last. So is that the devaluing of the lives in that correctional facility? And his argument is that because of short of staff. Well, technically, you can have your Department of Health staff go inside the facility and administer vaccines. So that's not an excuse to dehumanize and refuse access to a vaccine to that population.
Yeah. And so talk about the work that you're doing right now. Obviously, very busy on the front lines dealing with the issues of decarceration. When we talk about from a political perspective, government officials, finding government officials to this whole issue of decarceration, given the fact that when you look at most of the low-level offenses, we're finding those are people in communities of color, people who simply cannot just raise bail. And we knew that there's the bail reform, but these issues still exist.
So, and I think we're in this moment of racial reckoning. And as advocates, as an organization that empowers advocates to speak their voice, we're really talking about this from a civil and human rights perspective, right? So the criminal justice system, and what I share with communities is, the criminal justice system is the catch basin to all the other failed systems. And if we can continue to just focus on the criminal justice system to decarcerate, we're not stopping the other systems that funnel into it, right? So it's not an either or, it's an and plus these other systems of having access to basic education, having access to affordable housing, having access to living wages through employment and different things of that nature, but also having access, and a lot of times people miss this, having access to substance abuse and mental health. Growing up, just to be honest, Darren, growing up in America as an African-American is traumatizing enough. Then if you add in our violent communities that happen, then you add in incarceration. Those are all traumatic endpoints that nobody addresses from our community. So we send people back out to the community and say, be successful, when nobody ever addressed the traumatic experience the individual has had and learned to suppress that actually comes out in different things, right? So when we talk about this decarceration, I no longer want to talk about it from releasing people. I want to talk about it from a human rights of, should we be incarcerated and punishing people for being poor? Because bail is only acknowledging my return to court. When you put $1 million bail on me because I stole a $20 steak, you already knew I couldn't afford anything, right? So are you criminalizing me for being impoverished and different things of that nature? Really looking at it, but also acknowledging the historical legacy of slavery in the criminal justice system, right? How it was created at the abolishment of slavery, how bail reform is nothing but the bailsman selling my freedom back to my family, just like slave owners sold you on the Capitol steps. GPS monitoring is nothing but the electronic version of shackling. Probation and parole is nothing but community-based prisons, because even your family is now under surveillance and their house can be disrupted, disrespected, just like the correctional officers do in your cell, right? So looking at the custodial, and then we add on top of it, now that you have this conviction, you can't live here, you can't work here, you can't have access to this, you can't attend your child. So it's still those Jim Crow laws of where you couldn't live and work and what you couldn't do that are actually perpetrating through the criminal justice. And I think what we see nationally is, even when we fight for our voting rights, there are people who don't want us to have that power. So it's almost still a dehumanization of a sub-segment of society. We are people. We made a mistake. And if you say your Department of Corrections and Rehabilitation is supposed to do that and you believe in it, why are you still holding me accountable when I come back to the community? So when we talk from that, there's something that is triggered in the DNA of those in power of suppressing and oppressing a certain margin of population. But when we talk about it from a human rights and a civil rights perspective, it actually forces them to look at their racism face to face of why they feel this certain group of people don't have a right to what they're allocating or advocating for everybody else.
And before we go, there's so much we can talk about. I mean, we got to bring it back and we can continue this conversation, but I want to get an opportunity to get people connected to you. How can they get connected to the work, and how can they support what you're advocating for?
Definitely go to our website at www.jlusa.org. Sign up for our newsletters, get engaged in some of the work. We can connect you with the advocates. What I like to tell people, the work in New York, our goal was to empower, educate, and elevate the voices of those directly impacted. And what you're seeing now is those individuals who have been impacted on autopilot. They are not going to let go. So it brings us joy to know that exactly what we set out with this young organization to do is actually being demonstrated right there in New York. But definitely visit our website. We could connect you. We're a national organization. We have advocates, leaders across the country that are working on some really good ideas that actually bring human rights and civil rights back to individuals who have been marginalized the most.
DeAnna Hoskins, thank you so much for being with us. I really appreciate you taking the time to be with us today, sharing a lot about Just Leadership USA, and most of all, decarceration. Got to bring it back.
Yes, thank you, Daren. Got to. Thank you, guys. Thank you, viewers.
All righty. Well, listen, taking a quick break. We do have more show. I don't want you to go anywhere. We're going to continue talking, and later on we'll be talking to the George Floyd organization. Really, we are George Floyd. You'll find out more about that and more here on the Social Justice Forums.